During the difficult last stages of a serious illness, many people feel they've lost control of their lives and over what will happen to them. Hospice care can show you your options, and knowing your options gives you back some control. It allows you to make decisions about things that are important to you. Susan Ritzenthaler, the Admissions Manager for Lake and Sumter Counties at Cornerstone Hospice, explains how to tell when it's the right time for hospice care.
An appropriate patient is someone who you might think is not going to be here in a year. They have a terminal disease or a chronic condition that keeps worsening. And they're changing their goals. It's about living instead of about treatment. So instead of going to a hospital for treatment for the disease, it's about making the symptoms comfortable enough to live with. So we have clinicians and admission nurses that go to your home or meet you in the hospital or in a nursing facility, wherever someone lives, and we discuss what hospice is and assess if they're appropriate for a hospice program. Some of the diseases that are most common for us is anyone with a terminal cancer diagnosis who's at the end of their cardiac history. So if they have congestive heart failure, chronic obstructive pulmonary disease, AIDS or HIV, Alzheimer's or dementia patients who are at the end phase of that disease process. Those are some of the diseases that are appropriate for a hospice patient. We approach a patient and family with a difficult conversation. We want to know what their goals of care are. We want to know how they see their life to end. It's a difficult conversation, but they have noticed that their symptoms are becoming debilitating, or they're making more and more frequent trips to the hospital. And we try to focus on how we can help with symptom management and thinking about treating the symptoms rather than treating the disease. I get asked a lot, how do you do what you do? And people look at you like you're a special, extraordinary person because you can deal with death. Well, I'm really dealing with the living and how to make your life better. We don't need a lot of praise for what we do. We just know how to make a difference. And when you leave a patient's bedside and you know that you've worked on getting that symptom under control, or you leave their house and you know you've had a great conversation, you kind of learn how to live through those who are dying. You don't take your own life for granted any longer. You live in the moment and in the minute. And I think that the best quality for me is to help the people that do that day to day learn how to do that.
To find out more about hospice and the palliative care services available at Cornerstone, follow the Right Time Story link on our homepage, yourhometownhealth.com.